Hi, everybody, and welcome to episode 137 of the Veterinary Behaviour Chat podcast. So, today I thought I would talk a little bit about interoception, the eighth sense, and what made me come up with the idea for this episode is actually the call that we had on the Behaviour Case Collective most recently, which was just a couple of nights ago. So the third case, I actually had my wonderful colleague and friend, Dr. Amber Batson, co-present a case with me that was all to do with gastrointestinal health and behaviour. And this idea of interoception came up during that call. And I thought, wow, that would be actually a really cool topic to dive a little bit deeper into, because I think not many of us are familiar perhaps necessarily with that term. And I think it's really important as it relates to veterinary behavior medicine, especially, I guess, the more sort of more recent approaches to ways of thinking about things in terms of, physical health contributions, how the animal feels, and what we can do to help them. That isn't necessarily our sort of traditional view of training. Now, of course, there is always a place for learning and for learning new things. But I think when we're thinking about veterinary behavior medicine, we're oftentimes thinking more about therapy or therapeutic approaches, ways in which we can help our patients feel differently, improve their well-being, improve their experience of their life, their world, themselves. So yeah, I thought I would dive into a little bit what interoception means and what we can maybe think about for our veterinary patients in terms of modulating that, because it's quite interesting when you look sort of at the human side of things. The types of things that they use for treatment aren't always that easy to replicate in the veterinary world. So I'm going to kind of divide today's podcast episode into three sections. I'm going to start a little bit off with a definition. What even is interoception? What do we kind of think about? And then I'm going to talk a little bit about what if you have altered interoception, which is kind of then the sort of abnormal state, or I guess the out of range or the extremes of spectrum, maybe, state of interoception. And then finally, in the third piece, we'll talk a little bit about what could some ways of addressing, I'm going to say treating loosely, but addressing and improving that patient's interoception, or perhaps normalizing it on the spectrum. What could that look like? Okay. So firstly, what is interoception? And it's sometimes also referred to as the eighth sense. So if we just go quickly through our senses again, so we have our five classic senses, which are vision, hearing, touch, smell, and taste, right? They would be our five classic senses. And then aside from those five classic senses, we have what we call three hidden senses. The first one being our sort of vestibular experience. So that has a lot to do with balance and kind of the writing of our whole body, I guess, in space, within space. We all know what it feels like potentially to be dizzy or have vertigo. And we can see it in our veterinary patients that have vestibular signs or vestibular disease. They'll circle in one direction, they'll have, perhaps a head tilt, and that can be also associated with the inner ear system. So that whole kind of idea of our vestibular sense, that kind of sense of balance, that would be number 6. Number 7 is proprioception. So that's the position of our body within space and how our individual body parts relate to that. And again, if we're thinking about sort of our classic tests for proprioceptive abilities, would be to position a dog's paw kind of on its back. So essentially to knuckle over their paw and to see how quickly they would right that. So it's about the body's ability to right itself, depending on those kind of deep proprioceptive senses. And then the final sense is this sense of interoception. And interoception is basically a sensory system. So we've got lots of different body areas involved, a sensory system that allows us to perceive and understand internal physical states and signals. So it's kind of how we perceive our bodies feeling on the inside. And classic examples of that would be hunger, thirst, the need to use the toilet, either to urinate or to defecate, but also experiences of pain and maybe its effects, so maybe muscle tension, other effects of disease, so nausea. So it's all that kind of internal state of feeling, which then also has a strong, I guess, relation on, or has a strong effect on emotions. So how we emotionally perceive those internal states. Now, these kind of internal states are obviously transmitted through neurons, and we've got a couple of really specific neurons here. So that would be the piezo, P-E-I-Z-O, piezo 1 and 2 neurons that are kind of mechanical neurons or mechanical sensors that particularly involved in touch and other mechanical sensations, but they've also been found in a lot of internal organs, including blood vessels, and you get quite sort of an understanding that they measure for mechanical outputs. So that could be blood vessels contracting or expanding. That could be contractility of the heart muscle, for example. So these neurons would then relay information to our brain. It goes to the thalamus, which is our central relay station, and is then interpreted. And then our body would output in response to those interpretations. And it's always the body's desire to return to a state of homeostasis, or kind of back to a neutral state. So, for example, if the body perceives the need to urinate, then the direct effect of that will be to urinate and empty the bladder. Similarly with defecation, similarly with hunger and thirst, right? If the body perceives that those sort of signals that come from this sensory processing, that it's hungry, it will then, the body will, or the organism, the animal, us, whoever, will go out and seek food to fill the stomach and kind of get back to that place of homeostasis. So it's all about how we feel internally, and how those internal feelings, or those internal states, can potentially relate to how we in our emotional state. Now, it's not the same as visceroception. So visceroception would perhaps be a very sort of specialized area of interoception, which is really truly to do with our visceral organs. But interoception really is, I guess, a way of understanding and assessing how we feel internally. Now, interoception can be altered. So we're kind of moving over to the second part, I guess, a little bit of what I wanted to talk about. So interoception can be altered. So we can either have hypersensitivity or heightened states of interoception, which oftentimes can lead to anxiety. So it's like this excessive perception of these internal states. So it's like almost having a sensory overload from these internal states, which can lead to anxiety and feelings of overwhelm, emotional dysregulation. So that would be an altered interoception in that direction. And similarly, we can have a hyposensitivity. So we can almost have a shutting down maybe of the experience of those internal senses. So we might see that in human patients with PTSD, for example, or that could mean that perhaps an animal is less likely to understand when they're hungry or thirsty, or maybe not act upon it appropriately. Similarly, if their bladders or their bowel is full, they might not act upon that appropriately. And I can think of one case in particular that I've had recently where I wonder whether that may have been a part of the kind of the presentation. So a super anxious dog in an environment that perhaps wasn't the most suitable, that spent a prolonged period of time in a very shut down state and didn't urinate and defecate nearly as much as we would deem it to be considered normal, and then also urinated and defecated pretty much in inappropriate areas. But you almost, and again, actually, if I think about it now, other cases, right, where we've had dogs that have been in extreme shutdown fear states that haven't urinated or defecated for a number of days sometimes. I can think of a few rescue dogs actually that I've consulted on that have maybe been transported across Europe and then arrived at their destination and have basically just remained in their crate for, days without coming out for a pee or a poo. So I just wonder whether, that could be part of it. Obviously, we've got extreme fear and panic states, but for sure, if you read the human literature on interoception, there are a number of emotional disorders that are associated with altered interoception, anxiety disorders, panic states, certain types of so anorexia, bulimia, eating disorders, also compulsive behaviors. So there you can understand how perhaps a number of these emotional states can be linked to altered interoception, where, what we would perceive normally bodily functions to be are not being carried out or are not happening due to altered emotional states. So it's a bit of a kind of complex topic, but for sure, I think it's really important to think about these altered states. And I think when we think about altered states as well, we also think about, excessive experiences of some of those things: pain, muscle tension, visceral pain, in relation to GI disease. And that's where kind of this came from when we were talking about this in the Behaviour Case Collective with Dr. Amber Batson, and we were talking about, altered interoception as a result of GI disease. So I think that's something really, really important to think about. And now the third piece of the puzzle is, if we're suspecting altered interoception, so any of kind of our almost physical internal senses being altered. So if we do have patients that don't urinate, defecate, in fact, actually, the more I think about it, I also have a number of patients that are really fearful, perhaps at certain times of the day, in the evenings, don't want to go for walks, may not pee or poo on that evening walk because they're too scared. So actually, I think potentially it does happen quite often. And then, the question is, well, if we have these altered states of interoception, how do we deal with them, both if they're hyper or hyposensitive? So if we have a patient that's, extremely anxious, and we might actually have, increased, that sort of increased sensory processing from internal states, or decreased. So, interestingly, when you go back to kind of the human side of things, it's a lot of the therapies or the things that are said to help with altered interoception states are things like yoga, meditation, mindfulness, occupational therapy, cognitive behavioral therapies, understanding better, sort of having a better mind-body connection, I guess. So being more aware in your mind of what's happening in your body, and perhaps being able to alter things through that. And of course, the million-dollar question now is, well, how do we transfer some of these therapeutic methodologies that are, very, very common and very instrumental and important in human psychiatry and human psychology and treatment? How do we transfer those to our veterinary patients? And I think there are a few things that we absolutely can think about. And that's what I was talking about earlier a little bit, in terms of, maybe the slightly newer or more modern approach to veterinary behavior medicine, where we're really thinking about that sort of emotional and physical experience and that well-being piece, and how the animal actually feels in its own body and the type of experience they have in their own bodies, as a really big piece of what we want to do from a therapy point of view. So the first point, obviously, when it comes to treatment, is absolutely veterinary care, right? We want to make sure that we can rule out physical pain and discomfort as much as possible, whether that is from musculoskeletal pain, whether that's from GI or other visceral pain, whether that's perhaps from skin inflammation, irritation, itchy skin, Obviously, we want to make sure that we don't have a patient that's nauseous. We want to understand, maybe as a component of musculoskeletal pain, we want to understand muscle tension. So all of those things, we want to be making sure that we have as good a possible grasp on all those kind of real veterinary care pieces. So that would be the first one. The second piece is looking at environmental management. And I think both the physical as well as the social environments are really important here. If we have a patient that we feel struggles with sensory overload, and that can be, our 5 classic senses that we spoke about, as well as potentially that interoception piece, or maybe we have, difficulty in processing the 5 classic senses that then maybe leads to anxieties or changes in interoception. So reducing those sensory overloads, so making sure that we're able to provide our animals with escape places, the ability to rest and sleep, getting away from noisy environments, making sure we don't force physical interactions upon them, making sure that we reduce, let's say, visual input if that's something that they really struggle with. So a dog that constantly is patrolling, looking outside the door, outside the window, and reacting to visual triggers, things that they can hear, visual triggers are things that they can see or things that they can hear. So trying to reduce a lot of those kind of 5 classic senses inputs can be really important in managing, that nervous system and helping emotional regulation, and then also bringing that interoception piece perhaps more into the normal place on the spectrum. Sleep. So I've just mentioned that I think sleep is such an important piece for, internal state well-being. So making sure that we have really great opportunities of providing sleep. And I have a really great podcast episode, which I recorded with Dr. Carrie Tooley, all about sleep. So that's something that you can perhaps go back and have a listen to. And then I always think a lot of activities. Now, this doesn't apply to every single animal, and we're kind of talking about dogs specifically here, but licking, chewing, and sniffing. Now, there will be some dogs, and I had a patient just last week who may get overstimulated by some of those activities, licking, chewing, sniffing, right? Especially if they're very sensitive to smells and can become overstimulated, and perhaps their emotional dysregulation causes them to become overstimulated in that way. But there are many dogs that respond really well to licking and chewing and sniffing, and it actually causes them to feel calmer. If we're talking about cats, then we obviously want to make sure that we always have their 5 pillars of environmental needs met really appropriately, that they're able to play, perform predatory behaviors, do normal feline behaviors in terms of providing those outlets and helping emotional regulation. There are a couple of other things that I thought were really interesting. So if we're thinking about mindfulness, which is one of the things that we think about sort of in human treatment or in general for improving human mental and emotional health and well-being, then there can be things that we can do to help our patients kind of tune in more with their physical body. So restoring that kind of mind-body connection. So one of the really simple things we can do is offer them different surfaces to walk over. So we could supply either a sort of a textured surface, maybe for a dog to walk over, or, grass versus sand versus maybe really fine pebbles. We can get really great sort of physiotherapy type tools, these kind of platforms that can have textured surfaces that they can stand on or walk over. So all kind of with the idea of helping them to feel and sense things so that they become more present in their bodies, perhaps as opposed to extreme limbic system responses, fight, flight, high emotional arousal, and so on. So that surface exploration piece can be good. Slow movements. And again, I refer back to our amazing colleagues that do a lot of physio exercises or manual therapies with dogs and cats. is, causing them to perhaps stretch their necks and their bodies forwards, obviously as long as they don't have any physical health contraindications, or causing them to really slowly kind of sit down and stand up, again, if they don't have any hip issues or other problems, teaching them to lie on their sides in different body postures, as long as it's appropriate to do so. So again, creating really slow movements, which might be a little bit akin to our yoga, if that's what we think about. But again, it's just about re-regulating, some of these internal sensory systems to try and build healthy pathways here. Temperature contrast can be something that can work for some animals. So the experience of warm or even cold. So again, it's trying to sort of awaken the sensory systems in order to get that mind-body connection. And I would just really stress here that that might not be appropriate for every animal. However, some animals, if you think about dogs with osteoarthritis or muscle tension, and I know that from my own personal experience, tense muscles respond really well to heat. So, having kind of warming blankets or hot water bottles, again, to, relieve some of these unwanted interoception signals, perhaps, but also to, again, promote this mind-body connection. And then we can also think about other, learning pieces, such as capturing physiologic calm states. So reinforcing and rewarding for being calm. And when we're thinking about calm, we're not just thinking of a stationary animal, we're thinking about true physiologic signs of calm. So deep breathing. Dr. Karen Overall has been a proponent of deep breathing for years. So rewarding the moments when the dog takes a deep breath and understands that this is a behavior that is not only externally reinforced, but actually feels good. So we want to kind of marry up those internal and external reinforcement pieces. And then finally, obviously, we have the treatment of any emotional dysregulation disorders. So, treating anxiety, whether that might be with psychopharmacology or whether that could be with supplements or pheromones or other things. Actually, smell was one thing I was going to come back to with dogs. We know how amazing dogs are at smelling. And yes, I talked about sniffing a little bit. So, allowing them to sniff with snuffle mats and things like that, but introducing maybe different scents into the environment. And again, I had a patient just last week where we're going to try and couple a smell such as lavender with that physiologic relaxation piece, because she's extremely scent driven and can become overwhelmed by arousing smells and scents. So I think there is actually, when we think about it, quite a lot that we can do. I think initially, right, when you read yoga, mindfulness practice, occupational therapy, cognitive behavioral therapy, breathing exercises, you kind of think, well, how on earth are we going to kind of, how are we going to make that happen in our veterinary patients? But actually, there's quite a lot we can do. And I think all of these things are really to help get an understanding of where my individual patient or pet's interoception is, and also how can we kind of maybe help them re-regulate that. And then just coming back to dogs, this is a little bit different in cats, but coming back to dogs, I think that social environment piece, I spoke about the physical environment, but that social environment piece, having really strong, stable, healthy social attachments, whether that's to people or other dogs, other animals, is such an important piece. And I think for dogs, this plays a big part in regulation in general, but also potentially on some of those internal states, right? That kind of conflicted maybe state. So if the attachment styles maybe to the caregivers are anxious attachment, or if there's punishment or aversive methods being used, then that is something that for sure will cause anxiety. But again, it's thinking about how does the internal world of that animal look like? And I think that's where this interoception, this eighth sense, can play such an important role, or can be really an interesting thing to think about. So I just want to doubly remind you that this is all based on sensory processing through nociceptors, certain types of nociceptors, and actually has internal processing loops and circuits. So even though perhaps the last part of things went a little bit woo in terms of treatment, but I think it's really important that we understand that these are true physiologic responses, and they're really, really important for the overall well-being of our patients. And I think we think a lot about sensory processing and sensory experiences in our veterinary behavior patients, and I think we have to think above or outside just our 5 classic senses, and we really have to be thinking about, obviously, vestibular and proprioception are very specific, but that interoception piece is such an interesting one. It's almost, what does the internal world of our patients look like without them being able to verbally communicate that with us? I think it's easier for us to say, oh my God, my heart's really racing, or I really need to pee, I really need the loo, or I'm hungry, or I'm thirsty, or I'm feeling anxious, I'm feeling worried, or that kind of, frozen response, which is an absence maybe of some of those things, about hyposensitivity of the interoception. But being more aware of that in our veterinary patients, especially our veterinary behavior patients, is really, really important. Actually, not especially our veterinary behavior patients, all of our veterinary patients, I think, is really, really important, because at the end of the day, we want them to have a good experience of their life. We want them to live a life worth living. We want them to feel happy inside of themselves and inside of their bodies. And there's quite a bit that goes into that in terms of thinking about things and the way that we live with them and the opportunities we provide them to actually meet their needs, even if it's just the ability to go out to the toilet and pee, if that's what they need. If we think about sometimes dogs that are left alone for many hours per day. So yeah, we could go on and on and on, but I'm almost hitting the 30-minute mark. So I'm going to leave it there. A little bit of an introduction to interoception, something to think about, which I think is really important, and that we can have an influence on in many, many different ways. So I hope you found that interesting. When I started to deep dive into this, I was like, oh my God, okay, and there's this and there's that. Oh, we can think about it this way and that way, and this is what we can do. And we could be causing real problems by doing this or not doing that. So I hope it's given you a little bit of food for thought, and just something interesting to ponder. All right, thank you all for tuning in, and I will see you next week for episode 138. Bye for now.